share questions with us. So please ask any new questions today, and Dr. Mike Ryan and Dr. Maria van Kerkhove will answer. If you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, you can ask your questions via comments section, and our team will pass those questions to us. Mike, Maria, good afternoon. As we've seen in the past week and even previous week, the Omicron variant has dominated the news. So can we maybe start with the update? What do we know today that we didn't know a week ago when this variant was declared a variant of concern?
So hi, Alex. Perhaps I will start. So there's a lot of information that's coming in about this Omicron variant of concern that was classified by WHO last Friday. We're learning every day a little bit more about this variant, but it will take some time for us to have the complete picture about what this variant means in terms of the way it will behave as it transmits and spreads. What we know right now, we consider several factors. One, we look at transmissibility. Is it more transmissible or less compared to the other variants of concern that are circulating around the world? We look at severity and disease presentation. Is there a change in disease severity, either more or less? And we look at impact on countermeasures. The use of public health and social measures, do they still work? Diagnostics, therapeutics, vaccines, do they still work? So there's a lot of research that's underway. We, as WHO, are having meetings every single day, multiple times per day, with researchers in South Africa as well as around the world on this particular variant, Omicron, on all of those factors. So what we know. In terms of transmission, there's data that is coming from South Africa and from some modeling groups that are looking at the transmission. We do see an increasing growth rate. We see increasing numbers of Omicron being detected. And right now, the data is, I think, maybe a couple of hours old, but we have reports of Omicron in 38 countries in all 6 WHO regions. And we do see increasing trends in Omicron in South Africa. So there is a suggestion that there is increased transmissibility. What we need to understand is if it's more or less transmissible compared to Delta. The Delta variant is still dominant worldwide. That's important to keep in mind. So we need to see how Omicron compares with Delta when they're both circulating in the population at the same time. So it'll take a few more days, for us to get that information, and we're grateful for that research that's ongoing. With regards to severity, we have reports of people who are infected with Omicron that range in disease severity, from mild disease all the way to severe disease. Initial reports of Omicron came from a cluster of university students. And these tend to be younger individuals, and those individuals tend to present with more mild infection. So there was initial reports that it tended to be more mild, but it's really too soon. Because first of all, everybody who is infected with SARS-CoV-2, regardless of what variant, will always start out with a mild disease. And so maybe it will stop there with mild. Some people are asymptomatic, of course, but it may stop with mild disease, or it may take some time to develop severe disease. So it's too early for us to really understand severity for Omicron. We do also note that South Africa has reported increasing hospitalization rates, but that could be for the fact that we have more cases. If you have more cases, you will have more hospitalizations. If you have more hospitalizations, you'll have more deaths. So we need to determine, is it the factors associated with just any virus that's circulating in the population? Because if people are mixing, you don't have public health and social measures in place, and you add another variant, you will have more cases. Or is it actually the variant itself that is causing more severe disease? So that also will take some time. We're also looking at the impacts of our countermeasures. The big question right now are the vaccines. And this will take a little bit more time for us to understand the impact on our vaccines that are currently in use. Now, this variant has a number of mutations, a large number of mutations, some of which we know a little bit about because these same mutations have been identified in other variants. And there's other research that has been done, for example, with alpha, with beta, with gamma, with delta. And so we have some clues that we may have some reduced efficacy of vaccines, but we don't have that information yet, and it will take a week or 2 or 3 to get that. So there's a large number of scientists around the world that are working directly with us, directly with researchers in country to gather that data. And so that needs to take place, and we need science. We need the scientists to have a little bit more time before we have that answer. I think maybe I'll stop there, but it's kind of a fast and furious situation. But last point is we have these systems in place. We have a surveillance system globally for SARS-CoV-2 viruses. We're increasing genomic sequencing worldwide, and this helps us to detect these variants. And we have systems in place to share information. Sequences need to continue to be shared on platforms like GISAID, and we're thankful for GISAID for the platform that they have, so that analysis can be done. And we need researchers to communicate with each other, share their findings, and especially to share their findings with us so that we can make the right policy, advice, decisions, so that countries know what to do.
Thank you so much, Maria. Mike, do you have any reflections on the new knowledge in such a short period of time, actually since last week until today, on this new variant?
Again, with thanks to all those countries around the world who are really following up very intensively on the cases that they have, in particular to South Africa and Botswana, for the work that they've done. In fact, some of the best data has come out of South Africa in the last number of days. And it is, I agree with everything that Maria says. Clearly, the virus does appear to be transmitting efficiently, and we saw that before with Delta. So again, there's certain things we should be surprised with viruses, and other things we're not necessarily surprised with. I think we've all spoken collectively, even on this platform, many times about how one virus can replace another. The question is, in replacing another virus, what are the implications of that for our diagnostics, for our therapeutics, for vaccines, or for what we do to stop the virus? And right now, we've still got to keep doing the things we're doing, particularly in Europe, but all over the world, especially given that 99% of transmission going on in the world is Delta, to stop that virus. And if we do those things to stop the current strains that are circulating, then I think we'll be doing the right things to stop the Omicron variant, should it gain further foothold in the world. But just because we have a new variant doesn't mean the situation is going to get worse. It means we have more uncertainty now. And dealing with uncertainty is difficult. And it's not easy, because everyone was trying to get back to some kind of normal. But as we said here last week and the week before, with Delta, there was no normal. But it introduces a level of concern and a level of fear and a sense of more exhaustion that we all feel. Well, here we go again. But, you know, we knew this was going to happen. We spoke about it collectively here in this social media group. It's not a surprise that it's happened. And the right things are getting done. The right science is getting done. The right evidence is being collected. We've seen extreme transparency on behalf of the countries that have engaged. We're seeing a lot of the really positive behaviors that have led us to gain the knowledge we have. And now we need some patience to wait to get the answers from all of that data, which will come, and those answers will come. But we need that patience. And while we're patient, we have to recognize that the sky hasn't fallen in. Life needs to go on. And I think people out there have just got to get a sense that science has this, we have this. We're going to get the answers that everybody out there needs. We will make any changes that need to be made in any part of our control programs based on science, based on evidence, not based on fear, not based on politics, but based on public science, on national governments working with us, with international institutions to make good decisions that are in the interest of the public. They're not in the interest of profit, but the interest of public health. And I believe we have the architecture to do that, but it's just going to take a little time. In the meantime, I would say to everyone is do all the things we were doing before, because it's good for Delta, it's good for Omicron, it's good for any other variant. So keep doing what you're doing. If you were offered a vaccine, get vaccinated. Because right now, that's your best bet for any of these variants. And we'll wait to see what the outcomes of all the different investigations are. But caution now, not just because of Omicron, because of the other variants, Delta as well. And it may be that because of all of this increased activity and because of Omicron, we just may have to curtail some of our social mixing and gatherings over the coming weeks. And I know that's not a nice message for anyone to hear, but we were in that situation anyway without Omicron. We were in that situation anyway. I think what Omicron does is gives us an extra incentive to recognize that we're not out of this yet. Virus is not done with us. But as I said, we need to trust in the science now and be patient and not be fearful. We will be able to do whatever needs to be done to adjust our strategies, to adjust our countermeasures. We can do that. And this is a moment when science does have it. We got this, and we're accountable to everyone out there to make sure we get these decisions made as quickly as possible, based on best evidence and in the public interest, using public institutions to make those decisions.
Thank you so much. We're already receiving a lot of questions, and I will try maybe to summarize some. And you explained what we know so far about Omicron, and Maria, you highlighted that Omicron is not a dominant variant yet, at least not yet around the world. So maybe we can also provide, as usual, epidemiological update on what's the global situation at the moment with cases, hospitalizations, but also mortality.
Yeah, I mean, I can. So the emergence of this new variant is on top of the fact that we have a situation globally which is dominant by another variant of concern, the Delta variant. We're still seeing increasing cases around the world. Last week alone, there were almost 3.8 million cases reported at the global level. There's quite some differences by region and quite some differences by country. And in fact, some countries actually have transmission at a low level, which is a good sign, but others are seeing increasing rates. The thing that I think that concerns us the most is that, we're still seeing a high level of deaths. More than 47,000 people were reported to have died last week alone, and that number should be drastically reduced. And the reason for that is because we have vaccines. We have ample amounts of vaccines, around the world that need to get into the arms of people who are most at risk in all countries, and that's not happening. It's still not happening as we enter the third year of this pandemic, and as vaccines have been online for more than a year now, or almost a year now. So that's quite concerning to us. One of the biggest concerns before, was in the headline news before Omicron, was the situation in Europe. Within Europe, they've been seeing increasing trends for more than 2 months. So this is not anything new. Sorry, our shades are going up. Do you want? They have a mind of their own. Do you want me to wait? No. So we do see across Europe increasing trends over 2 months. So this is not new, and this is driven by the Delta variant. So if you add another variant of concern on top of that, the Omicron is going to complicate matters. But as Mike said, we don't know how it will unfold. So what we are asking all countries to do right now is to reassess your situation, critically reassess your situation, and look at what you're doing. First, look at your vaccine, access to vaccine and your vaccination policies, and focus on those who are most at risk first. It's not just about the number of people who have been vaccinated, it's who is vaccinated. And critically focus on those risk groups that you're missing. Mike has said before, and I think he said in the last live, know the names of all of those at-risk people, the vulnerable populations who've missed their vaccines, and find out why and see how they can be reached. This is what we know it will save lives, because in populations around the world that have been vaccinated, we see a massive reduction in severe disease in terms of hospitalization, admission to ICU, and deaths. The vaccines work. So in light of Omicron emergence, one of the most important things right now are people to get vaccinated when it's your turn and make sure you receive that full course. And the other thing is what we've been really stressing is that what is in place for Delta needs to be strengthened across the board. It does not mean lockdown. It means while we get vaccination coverage up, we also take measures to drive transmission down. And in countries that have transmission low, keep it low. Don't let the virus get the upper hand. Because again, as we enter this third year, the systems are completely exhausted. Our health workers are completely exhausted. And we need to do what we can to be aggressive, in these early cases so that it doesn't take off. So there's no reason to wait on that. We don't have to wait for any more data on Omicron for that, because what we need to do for Delta will benefit Omicron no matter how Omicron unfolds.
Thank you, Maria. You mentioned that one of the reasons we still have high number of deaths is vaccine inequity. And Mike, some viewers are asking for you if you can explain or say, what do you think, whether the Omicron variant will make this vaccine inequity situation worse? And there was a question in particular, if the science shows that we may need new vaccines for new variants, what can we do to prevent that we see the same scenario of vaccine inequity again?
It's a very good question.
There are a lot of questions, so I'm trying to bring together those that are on the same subject.
No, but it is. It's a very pertinent question. It'd be hard to think of a scenario in which vaccine equity could be much worse, but certainly there are always worst case scenarios in these situations. I think we're seeing, potentially one of the outcomes of vaccine inequity, in that if we're not vaccinating enough people in enough places, then the virus gets a free run. So I think the vaccine equity argument is not just being made on the basis of equity. It's also been made on the basis of that's the best way to use the vaccine to save lives. It's the best way to use the vaccine to prevent the emergence of variant strains. And it's the best way to use the vaccine if we want to treat each human life on the planet as equal to others. So it ticks the boxes on both sides. There is a danger now, and I think that's why it is important that we decide on what happens next together, globally, internationally. And that's why we've set up mechanisms like the technical advisory groups on vaccine evolution or virus evolution, the technical advisory group on vaccine composition for SARS-CoV-2, or a strategic advisory group on immunization. These are independent expert groups that are set up by the member states of this organization. They're brought together by the Director General. Their job is to make independent assessments of the state of virus evolution, to take that data and data coming from the research and development blueprint platform, from other science and research platforms around the world, to bring that data to the technical advisory group on vaccine composition, TAG, COVAC, so they can consider whether we need to change the composition of vaccines and how that should change. And that is turned into policy. That's the process we want to see. Public bodies, in transparency, making decisions about what the best strategy is, what the best composition is for vaccines. In doing that, then we have a better chance of ensuring some kind of equity, because the equity begins long before vaccines are manufactured. The inequity begins early in the process. And therefore, if you can create if your policy decisions and your scientific decisions are based on principles of equity as well as the principles of science, then you have a better chance down the line of ensuring that from end to end. There is obviously there are some concerns now that we're in the world of boosters right now, and we've seen with the issue of boosters that administering boosters to otherwise very, very healthy people, younger people, and then many governments have made that decision, but that puts pressure on vaccine supplies to people who've not received a first or even a second dose, and they're highly vulnerable people. So there's no question that policy decisions, and those decisions are we can say they're made in good faith, and governments make decisions to protect their own citizens. And everything we do in our lives, it doesn't matter. You make a decision for your family, but your decision can negatively impact your neighbours. It can negatively impact your community. So no decision you make in your life is uniquely reserved. The consequences are not only for you, they're for people around you. In the same way, we make decisions at national level, which on the face of it sound logical, and they sound principled. And they are within the context of your situation. But when you look at that in the context of the global community situation, those decisions are not so smart or equitable. So it's finding the balance between the two. And this has been the essential struggle during this pandemic. How do you balance the need to protect your own citizens within your own national borders, that absolute requirement? And it is an absolutely important requirement of governments. How can governments do that and at the same time deal with the issues and responsibilities to the global community and make smart decisions about how you use the vaccine to save the most lives, to prevent the emergence of variants? And I do see that if we're in this particular case, and there is no decision now, right now there is no need to change the vaccines we're currently using. Not at all. There is no evidence to support that. There is no evidence there to say we should change. But there's a lot of work going on to look at, if we were to change, how might we change those vaccines? And that work needs to be done up front. We need to look at, well, if we did have to change, how would we change it? If we did have to change, would the vaccines actually do the job we designed them for? So that preliminary work is already underway. But what we can say right now is that we need to change the vaccine. Right now we have highly effective vaccines that are working. We need to focus on getting them more equitably distributed. We need to focus on getting people most at risk vaccinated, the ones most likely to be hospitalized or die. We need to focus, be laser focused on that objective, but at the same time, do the work we need to do scientifically to prepare for a moment in which we may have to change things. And we're ready. We have the systems in place to be able to do that. But to answer the question briefly, yes, every time you change anything, the danger is that you will harden and hardwire inequity further into the system, or you amplify the inequity by not thinking about it as you go through the process. But it's also an opportunity in the same time to change the game the other way. There's also an opportunity for everyone to recognize, to recommit to the idea, the principle, that we're all in this together. And not just from a solidarity point of view, but from the point of view of the best way to prevent this virus evolving is to share vaccine equitably around the world. Maybe this is just another warning shot to us that we're not doing so well on equity, and if we were doing a bit better in equity, we might be doing a bit better in this pandemic response.
You know, I'm thinking of Mike's explanation is just excellent, and I think, you know, what I would like people to understand who are watching this, because we talk to policy advisors, we talk to governments, we talk to scientists, but this is for the general public too, right? We need people out there to understand that we're on it, in the sense that we, WHO, our partners, our scientific collaborators, our member states are on it in terms of tracking variants. What is emerging? And this is, you know, this variant was detected very, very quickly. It was reported to us very quickly, and as Mike has said, the process is in place. The process to analyze, to assess, to debate, you know, what does this data mean and what will it mean for policy decisions? So there are a lot of people on it, regardless of if it's weekends or holidays, and of course many holidays are coming up, but there are many people that are looking at this. But from a general public point of view, what does this mean for you? What it means for you is that there are tools out there right now that can help save your life. And these are safe and effective vaccines. With the Delta variant that is dominant, your chances of going into hospital, needing to be admitted to ICU and dying are far, far less if you are vaccinated than if you don't have that vaccine. And that's what vaccine equity is. It's making sure those people who are most at risk get the vaccine first before we start giving more doses to people who are already well protected. And I don't think we can say that loud enough. And more people out there probably should be saying that a lot louder, because that is a fact. And that will not change regardless of how Omicron unfolds. So that needs to be done. So know what you need to do to keep yourself safe. And when you're offered a vaccine, get vaccinated and receive the full course.
Thank you so much, Maria. We have a lot of questions, but maybe I will ask this one now, because you mentioned that this new variant, Omicron, that we're talking about today, has been detected early and reported to us early. And one of the viewers was asking, why this is the second variant of concern that we got reports from South Africa, and why is that? So I think this is an opportunity to explain the good science that is done in South Africa.
This is an excellent question. I mean, these variants are detected where we have good surveillance. And this is also a cry to have better surveillance around the world, to not only detect variants, but detect the virus, first of all, but to have sequencing be done so that we can look for the emergence of these variants. Now, South Africa has worked very hard over many years, and in particular over the last 2 years, to increase their surveillance around the country, to support other countries in Southern Africa to do sequencing. And the fact that they were in a good position to be able to do those sequences, contact us, which we're in regular contact with researchers from South Africa, present to our technical advisory group for virus evolution, share their sequences with GISAID, with the world, put us as WHO and put everyone else in a better position to take some action. So South Africa was the first to report this variant, but also keep in mind, as sequencing backlogs get caught up, because there are a lot of sequences that haven't yet been sequenced from November, in many parts of the world, not just in Africa, but even in Europe, the timeline may change. So some of the earliest cases of this particular variant may very well not be in South Africa. We should also thank Botswana for the work that they did, because they also detected this variant very early and shared that information. So countries that detect these variants, that share this information, should not be punished, because we really need an open and a transparent system so that organizations like us can take that information and advise. And so I think that's a really great question. It isn't a negative that they've identified it. It's in fact quite a positive. And we'll thank them again for all the great work that they're doing.
Thank you so much, Maria. I'm going to go back now to the first question that we received today. A viewer on LinkedIn is saying, I would like to know how Omicron variant can be diagnosed.
Ooh, that's a good question. So people, you want me to start or you want to start? I'll start. So that's a really good question, because when people are infected with this virus, it's a respiratory virus. So people who have COVID-19, which is the disease, can range from anything from very, very mild symptoms, loss of taste, loss of smell, all the way through very severe pneumonia and death. And then of course you can have people who are asymptomatic. Just based on clinical features, you can't tell which virus people are infected with, whether it's the COVID-19 virus or even influenza or even RSV, other respiratory pathogens. For us to determine if it's Omicron right now, it's through sequencing. And so sequencing is not done everywhere. Until we know more about the disease profile in terms of what people are presenting with, we don't have any indication that it's different than other strains of SARS-CoV-2 that are circulating. So it comes with a diagnostic test to know if they have SARS-CoV-2, then sequencing if they have this Omicron. Now there's one PCR test that's out there that has this S gene dropout, it's called, and that's used as a surrogate for Omicron in absence of sequencing. But we don't know enough about that yet, because Alpha was also detected that way. But you don't know what you're infected with until you get that diagnostic test, which is why we need better testing around the world, a quick result, and then linked to public health action. But the viewer at home, if you are feeling unwell, there's steps that you can take to get tested, to make sure that you isolate and you protect yourself and your family, that you get into the clinical care pathway early. It shouldn't matter which variant you have. Just make sure that you take care of yourself, you seek care, and then you prevent the virus spreading from you to other people.
Thank you.
I think that's the thing. Regardless of the variant, if you're unwell or you feel symptomatic, and in many cases aren't, but if you're feeling symptomatic, or if you're a very close contact of someone who has been a confirmed case, but let's say you're just feeling unwell and you have access to tests, get tested, self-test, get tested in a local clinic, because if you are a COVID-19 case, even if you're mildly symptomatic or asymptomatic, you will transmit to other people if you go to work, if you engage in social activities. We saw that, and we've seen that with the Delta strain returning in Europe. Even people who are vaccinated participating in the transmission chain, even though they're not getting sick themselves. So that's the fact, and that doesn't matter which variant you're infected with. And I think we really do. I think everyone's become a little complacent around that in the last number of months. Certainly here in Geneva, in the office here, you'll hear in my voice, there's a cold going around at the moment, and I don't know whether the number of PCR tests and antigen tests we're taking and having to make sure that everyone stays well. And I think that's important, that we expand the use of testing where we can. Now that's easy to say in a European context. That's not so easy when we talk about developing countries. And there's another inequity there, which is it's not just vaccine inequity, but there's a lack of equity in the availability of tests. There's a lack of availability or equity in the availability of all the other measures we use. But if you have access to testing, you can reduce your risk of infecting someone else by self-isolating if you're sick. But I've seen it myself, and I've heard too many stories in the last number of weeks of people just being unwell and not getting tested, and that's really driving the disease transmission. Because one individual in a situation like that, especially often someone who's well because they're not sick, so there's no signal to anyone else that they're sick, can do a lot of damage and spread a lot of virus in a work environment or in a mixed social environment. So it's really important that people get tested if they feel they've been exposed or if they feel unwell.
Thank you very much. And just Maria, maybe to clarify, because several viewers on Facebook were asking about the symptoms from the Omicron variant. As far as I understood, we don't have any information that it has different symptoms than others.
That's correct. Yeah.
Thank you. And
It's our quickest answer.
And one very important thing I think for people to understand, because you'll hear this on the TV, and it is good news in a sense, but we have to also be cautious, because a lot of people are saying, oh, all the cases are mild, and God, I hope that remains to be the case. But we saw that before with Alpha, with Delta. At the beginning, when a new variant arrives, it tends to spread most quickly in those people who are mixing most socially. And in South Africa, that was mainly younger people. So the fact that most of the cases are mild reflects probably the fact that it's spreading amongst otherwise young and healthy people. And there's also a time factor. It takes time, unfortunately. We saw that as well in previous waves of this pandemic. When the incidence rate goes up, it takes a week or two for that to result in hospital admissions or deaths. Now, I hope that the current increase in transmission and the current increasing numbers of the Omicron variant do not result in increased hospitalizations or deaths. But based on the data we have from a mainly younger population in which we have a highly transmissible strain, you can't say with absolute certainty that we won't see, because someone was saying to me the other day, it could be even less virulent than the Delta strain, and then it'll be great, won't it? And I felt like saying to the person, I wish I had your optimism. So I think we need to be careful in the coming weeks to keep an eye on the data and the hospital admission data, just to be sure that we're measuring the right thing, because we don't want to give false reassurance to people, and neither do we want to scare or bring fear into people's lives. So you'll hear a lot of things in the coming weeks, and I think it'll be a bit of a roller coaster for everyone, quite honestly. Today it'll be, yes, everything is fine and it's going to be fine, and tomorrow we'll hear something else. There'll be papers produced, there'll be preprints going online, and everyone will kind of swing a little bit over the next week or two. And we just need to stay centered and not go to the extremes of any analysis, and just stay balanced in how we look at the data that emerges. And we're doing that together in real time. There was a time when scientists would look at all this data and nobody in the public would know, and eventually a month later, there'd be a result. That's not how the world works anymore. Everything is happening in real time. Data is out there in real time. You're all getting the data as we're getting the data. So that's great, because that's fantastic for transparency. It's fantastic for openness. It's fantastic for community empowerment. But it's also unsettling, because the answers aren't there. And that's the world we live in. So we've got to get used to living in that world where getting the real evidence and answers is slightly behind getting all the data and all this kind of unlinked information. I know that sounds rather philosophical, but that's the world we live in, and we all live with that uncertainty. Even for myself, I would like to know the answers, even for my own family, to be able to give reassurance to my own family, and we can't. So I think, with all the advantages we have of these wonderful platforms, social media, and all of the that process of opening up and getting rid of the old information silos and the cabals of information, it's fantastic. I love that. But the price of that is the kind of uncertainty we feel right now until we pull all that information together.
Thank you, Mike. I'm glad you brought that up because actually several viewers were asking if this variant is more deadly than others, and do we have any deaths reported so far from Omicron? And I think you just answered now that we don't know yet fully.
We just don't have the full picture yet. And I think, as Mike said, I've actually said several times today, I think that the next days to weeks will be a little bit confusing, a little bit messy, because we won't have that certainty that we want. And there will be a lot of papers that will come out, will come out as preprints. And we are in a good position where a lot of those researchers are presenting to us before they even become preprints. But it will swing, as Mike says. We'll have some information and it will seem certain, but we have to look at the evidence as a whole. And we will, make these assessments with our partners and pull it all together and advise based on a collective knowledge as opposed to one piece here and one piece there. But it will be a little bit messy in the coming days. But it doesn't mean that the right studies aren't underway, and it doesn't mean that the right studies will come. So the ones on vaccine, which everyone is most concerned about or seems to be most concerned about, those will take a few weeks. And we need the scientists to have the time to do that. But from a policy perspective, from governments, what we're asking for is for governments to really double down on the efforts against Delta. Because in the Northern Hemisphere, we are already seeing increasing trends in cases. And in some countries, especially where they have low vaccination coverage, we are seeing increasing hospitalizations, we're seeing ICUs overwhelmed now. So if we can double down on the efforts to suppress transmission, drive transmission down, again, I don't mean lockdown, I mean the use of masks, physical distancing, avoiding crowds, supporting people to work from home who can, because many people can now, so that those who cannot work from home have less congestion on public transportation, for example. Make the investments to improve ventilation where we work, where we live, where we study. All of that takes time, but that needs to be invested in now. And so what governments do in the next 2 weeks, 6 weeks, 8 weeks, 10 weeks, will determine how Omicron unfolds. So if those measures can be enhanced, if surveillance can be enhanced, if we can reduce transmission as much as we can now, this will benefit however Omicron unfolds. We will keep saying that because I think that's a really, really important message. And the Director General gave that message to all member states this week. And it resonated. So we will keep repeating that because it's really critical, especially in the Northern Hemisphere as we go into the winter months. People will spend more time indoors. The holidays are coming up, so we will increase our social mixing. Do not let your guard down. This pandemic is not over.
Thank you, Maria. Here's a question from Niam Dudi, watching us on Facebook and saying that South Africa has reported an increase of hospitalized young people. Is there a link in this with the new variant and the lack of vaccines in that age group?
So we do see increasing hospitalizations across South Africa, as I mentioned in the beginning. We don't have the outcome data for those individuals. We haven't seen an increased risk of death yet. So we have to wait to understand how those patients will do. But we don't see any change in mortality at the present time. And as more information comes available, we'll let you know. I should mention, as Mike mentioned on the mild cases, if we only look at the travelers, so what I mentioned in the beginning that 38 countries have detected Omicron. Those are mainly among travelers, but not only. Those individuals tend to be mild as well, because if you're traveling, you're not sick, or you shouldn't be traveling if you're sick. So there's a bias in terms of what is being detected at the moment, but that will change over time.
And just on that, numbers of people coming into hospital increasing is a concern, but remember South Africa had reached a very low ebb in the pandemic. South Africa had really had very low numbers of cases daily up to this surge in the last couple of weeks. So you would expect from a very low level of hospitalization, if you get a very rapid increase, even of a reasonably mild variant, you'll see more hospitalizations just because you've got a lot of cases coming through the system at one time. So I think it's too early, and as I say, I've had different reports. Some people reporting from South Africa who work on the primary healthcare side are saying, oh, they're all mild, and then some people in the hospital saying, well, we're seeing some people come through with severe symptoms. So it reminds me quite much of the Delta and the Alpha before, that period where it's just going to take time to pull all that data together. And again, South Africa is the ability in South Africa to link their testing data to sequencing and to clinical data and it's remarkable. Mm-hmm. It really is remarkable, and it shows you what can be achieved. And Botswana is doing the same now, and others, and we're seeing that ability to do real-time epidemiology, laboratory, integrated analytics, to bring all that data together in real time. That's really improving in many, many countries, but there are big gaps. There are big silent areas where we don't have that. And we simply don't know where, for example, even at the end, this particular variant was picked up in South Africa. That doesn't mean that it began in South Africa, not at all. It just means that we had the signal from South Africa because they were on the alert, they had the systems to pick this up, and most importantly, they were truly transparent in sharing this information with the rest of the world. I wish we had that behaviour from every country on this planet.
Thank you, Mike. Here's the next question from James Hunter. I think we had this question as well before as new variants were emerging. But can you get Delta and Omicron at the same time?
I don't know about Omicron. We don't know enough yet, but there are situations for many viruses where a person can be infected with two variants or two strains of the same virus at one time, and that can happen. Obviously, you're particularly unlucky to be exposed to two different variants at one time. It happens in influenza classically, and that's very often how influenza evolves. There's a process as influenza viruses evolve of what they call antigenic drift, where slowly over time viruses can gain mutations. The influenza virus can. But there is a concept of antigenic shift, where either one person is infected with an avian strain and a human strain, or a pig might be infected with a human strain and an avian strain, and what comes out the other end is a recombinant or a recombined, reassorted vaccine. They're called reassortants or recombinant viruses, and that can happen. So yes, it is possible to be infected with two different variants at the same time. That's obviously something that the immune system has to deal with at that time, but it's an important part too of virus evolution in some cases, where the virus can use, especially some viruses are really good at doing that. They've evolved an ability to essentially exchange genetic material as they both infect the human, and that can result in some very big shifts. And most of those viruses that emerge from that process are not fit. Most of those viruses die off, but just now and again you get one that can cause problems. The last pandemic of influenza was caused by a triple reassortant, a vaccine that had reassorted between human, avian, and swine influenza. So your listener is smart. It is something that can happen, and it's something we need to keep an eye out for.
Get your flu vaccine.
Yeah,
so
and it also says that's why
vaccine.
We should be vaccinating
vaccine
people.
For flu. You get your vaccine for COVID. Get your vaccines for flu.
Thank you, Maria. Maybe this question you can take from Lena Olson. Could you comment on the fact that several variants are considered not bad enough to be of concern? So maybe the difference on how we classify variant of interest and variants of concern.
Yeah, so as you know, the virus changes a lot, and it's been evolving and mutating, since it first emerged. This is what viruses do. It's a natural thing. There are many variants that WHO has been monitoring with our virus evolution working group and now this technical advisory group. More than 50 or 60. I don't actually know the number to date of how many variants we are looking at. We make assessments of whether they're a variant of interest or a variant of concern based on the way that they behave, the way that if they have any detrimental effect on the epidemiology, if they cause more severe disease, if they have demonstrated increased transmissibility, and it's just a level. So we have variants under monitoring, and there's 40 or 50 or 60 variants under monitoring that we've been tracking. And I should say there, Delta is also still evolving, and so there are at least 30 sublineages of Delta that we're tracking right now. Those are under the variants of monitoring. If they have some properties that are concerning, we have the definitions online, then they will be considered a variant of interest. And if they have a demonstrated change in transmissibility or a detrimental change to the epidemiology, which is why we classified Omicron as a variant of concern, if there are properties of immune escape, for example, we will classify a variant as a variant of concern. But one of the things I think it's also important for viewers to understand is that it's not just the emergence of a variant, it's if that variant starts to circulate. So there are two variants under variants of interest, lambda and mu, that have emerged, that have some properties that are concerning, but they haven't really taken off when you compare them to Delta. So Delta has outcompeted all of the other variants circulating. Now with Omicron, we have to see what happens. In South Africa, it's emerged in a time where they've gone through their third wave, and they just followed a big Delta wave. They have transmission down at a low level. So the question will become, in areas where both variants are circulating, what's going to happen? Which one is going to outcompete each other?
Thank you, Maria. Mike, this question is for you. As you were talking about strategy in case we need new vaccines, so the viewer who has the same name like you, Michael, is asking, have we discussed the healthcare staffing shortages across the globe in case we have this variant that has potential to be even more dangerous?
Well, I think, again, going back to what Maria said, we're seeing this with the Delta surge at the moment and the wave in Europe and other places. Healthcare systems coming under huge pressure and healthcare workers coming under pressure. And that's even in the context of fewer admissions, because health systems are tired, exhausted, health workers are tired, and we're seeing a lot of health workers leaving the professions because of this sustained stress and strain. In some countries because of stigma and attacks, verbal and otherwise, on health workers. So it's not been an easy time for health workers for all kinds of different reasons. So yes, it's not the specific emergence of Omicron that concerns me. What concerns me is the sustained transmission that leads to sustained pressure on the health system. And it doesn't matter how good you are at anything. If you have to do it for too long, you get inefficient. If you have to do it for too long, you get exhausted. Can you imagine being a health worker in the current environment, working in an intensive care unit, working on ventilating patients again and again and again? It's tough. We have that going on, and working beyond your capacity the whole time. It's one thing to operate at 90% of your capacity and you can sustain that. But imagine operating at 200% every day, 7 days a week. Something has to give. And I think the mental health of many health workers has come under huge strain. I think their families have come under huge strain. And some of them have decided that in their own interest and that of their families, they're moving out of the profession, which is really sad. But also, systems to an extent have not protected them either. Why would you stay as a health worker working in a front line of a COVID-19 ward if you don't have personal protective equipment, if you haven't got a vaccine? And think about that. We talk about equity. There are health workers today going to work in low-income countries in COVID wards who are not vaccinated. We're vaccinating the budgies, and the parakeets, at this point, and in the Northern Hemisphere. And there are still health workers out there, and we expect them to go back in and fight the next wave of Delta or whatever comes from Omicron. What are we asking them to do? Yeah. We're asking them, to go beyond again and again and again, and we won't even give them the basic means to protect their own lives. PPE, training, reasonable conditions, and a vaccine to save their lives. So, I have huge admiration for health workers, people in primary health care, and people dealing with clinical care in hospitals. But I think they're really exhausted, and they're tired. And I don't know how many more waves they can be struck by before they, just topple over. And I think we have to understand that in our health system. Our health systems are fragile. They were not well invested in before this pandemic. We expected health workers to deliver beyond their capacities. We underinvested in primary health care. We underinvested in our ability to deal with these types of crises. And we've effectively based a lot of this response on goodwill, on the goodwill of our health workers to go beyond and keep going beyond and keep delivering. And I think we're in real danger, not because of Omicron, but because of Delta and other things, of really driving our health systems to even greater fragility now, unless we make some really, really strong investments in health systems resilience, and do it now.
Thank you, Mike. We are running out of time, and I have, I think, 2 questions. We received a lot, but I think these 2 we should take before we close. Maria, Twitter viewer is saying that the new report from South Africa tells that Omicron variant has 3 times more reinfection rate than Delta. So what are your views on this, and how countries can prepare?
So this is a preprint that has recently been published, but these researchers actually presented to us, I think it was yesterday or the day before, looking at the risk of reinfection across South Africa based on the different waves of infection that they have. And what they report in their preprint, so it's a non-peer-reviewed paper, but it's just releasing this information early to the public and to researchers around the world. They did find a 2 to 3 times increased risk of reinfection, meaning, and the way that they define reinfection is 2 tests 90 days apart, at least 90 days apart. That's not confirmed by sequencing, if I remember correctly in the paper. I apologize if I'm not quoting that appropriately. So that's not done by sequencing. There's a lot of limitations within the paper, which is not to say it's not a good paper, but just that the authors recognized because it's limited information so far in its early analysis. But what it's showing is that there is a risk of reinfection. Now these are mainly, we don't have the vaccination status of those individuals, or it hasn't been reported in that paper, as I understand. So it is possible. We know that people can be reinfected with SARS-CoV-2, but we need to wait to understand really what this means on a global scale. This is one study showing, some very good work that's ongoing. We'll let it go through that peer review, and there's a lot of people that are asking questions about this. But again, this is about, this shows that these studies, all of these types of studies can be done in the middle of a pandemic, in the middle of an incredibly difficult situation, and be shared so that we can take action. What it means for you watching at home is to take measures to lower your exposure to this virus, regardless of what variant is circulating. And there's so much that you can do. Distancing, wearing of a mask, avoiding crowds. If you can postpone travel, if you don't have to, then postpone. Make sure that you are in well-ventilated spaces, and people who run these businesses make sure that you improve ventilation in the places where people work and study and live. All of that matters. Take steps to know what your risk is, understand what your risk is, and take steps every day to lower your risk. That's what that study means for you.
And let me just add there, when all of the vaccines were designed, they were specifically designed to combat severe disease, hospitalization, and death. That was the benchmark that was laid out. And we saw with Delta how we saw reinfections of people with the Delta variant, but we saw the protection against severe disease, hospitalization, and death hold up really well. Remember, infection is diagnosed in your nose. So it's basically an infection in the mucosa of your nose, the lining of your nose. So you can be infected, and you can have a reinfection, and you could probably find the virus in the nose, but you're not sick because your immune system within the inside of your body, in effect, is mounting an immune response and able to cope with that infection. So reinfection does not automatically mean severe disease. Reinfection means you've been reinfected at the level of your nasal mucosa, but in the main what we found is the vaccines are still protecting the rest of your body, the internal part of your body, and that's what matters, your brain and your heart and your lungs, and they're the things that really matter. So I think it's important for people to recognize that and also to wait reinfection rates may be higher, but when the data comes through on vaccine protection, what the data we're really looking to see is going to be around severity of infection and whether or not the vaccines continue to protect against severe disease, hospitalization and death. And right now there's no reason to suppose that they won't. We just haven't got the data yet.
Thank you. And we can close with this from Anna Campagna. How aggressive should governments be in surveillance, testing and sequencing once a variant of concern is identified?
We're asking for all countries to increase and enhance their surveillance activities, their testing activities, getting those test results back to individuals quickly, and making sure those testing is linked to public health action. It's all about knowing where the virus is and preventing the onward spread, and for people who are infected to get into that clinical care pathway early. Early clinical care saves lives. We have the toolkit. Whether it's Omicron or the next variant, we have to use that toolkit. We do also ask for increasing efforts around sequencing and to ensure that those sequences are shared so that analysis can be done and we can understand virus evolution and we can understand how this virus is circulating. Now is the time to beef up the systems. You've heard us say that for quite some time now, but it's not too late to do this. Systems need to be reinforced. They need to be enhanced. Omicron is the latest variant of concern. There will be others. The more this virus circulates, the more opportunities it has to change. And right now, we have tools that can take the severe spectrum of disease, that can take the death out of COVID with these safe and effective vaccines. They just need to reach those who are most at risk in our country. And we have the tools to drive transmission down and keep transmission down. All of that needs to continue to happen.
Yeah. We just need to become just more consistent. It's not that, again, everyone is trying their best. You know, communities are trying their best, and scientists are trying their best, and politicians are trying their best within the world that they live in terms of the policy and everything. Everyone is trying their best, but what we've seen, what I've observed, is a lot of people, you know, a kind of a flip-flop, going for, you know, everything is fine, there's no problem at all, nothing to see here, to, oh my God, the sky's falling in, going from doing nothing to absolute lockdowns. We need to be more consistent. Viruses don't disappear overnight and disasters don't unfold overnight. It's finding a way of having consistent, multi-layered approach where a government and its society sit down and say, okay, what's the deal here? What are we going to do about this virus, about the rising trends? How are we going to increase testing? How are we going to make testing more available? It's one thing to say, test more, but if people don't have tests, if people don't have access to testing, then there's nothing you can do. And then when people are tested, well, if they are positive, what impact does that have? What are the services there to support people to be at home? If you're tested positive for a virus, but you know, you're a single mom and you've got to go out to work, well, you don't have many choices. So how are governments going to help people and to make good choices and support people in doing that? So I think we need to be more coherent, to be more consistent in what we do, and not just this flip-flopping sometimes from doing nothing to doing everything. I think that's hurt us in this response. We need to be persistent, consistent in what we do. And when we decide on a set of measures, to keep going with them and keep going, and then slowly change and adapt to the new situation that arises. Because I think it's been some of that rapid turning on the highway that's keeled us over at times. And I'd just like to see us now redouble our efforts. Omicron is a warning, as Delta was. It's telling us the virus is not done with us. There's still a way to go here. Maria keeps saying it, the pandemic will end. But we need to do everything we can to make it end, and we just need to recommit now to doing the things we need to do. I know it sounds deadly boring, but it's just the way it is, and we'll just sit here every week and just keep saying it, because it's the only way out of this.
Thank you both for your time. I know you need to run for another meeting, and I thank all our viewers for being with us. We'll keep updating you with everything new that we learn about this variant and in general on COVID-19, so stay with us on our channels and please stay safe.